Welcome to Trying to Conceive with Dr. Sasha Hakman, where we break down the science of fertility, share real patient stories, and explore the latest innovations in reproductive medicine. My name is Dr. Sasha Hakman, and I'm a double board certified OBGYN and reproductive endocrinologist and infertility specialist. I practice at HRC Fertility in Beverly Hills, but this podcast is an independent project created and hosted by me separate from my clinical work. Don't forget to subscribe so you never miss an episode. And if you want exclusive updates and resources, be sure to sign up for my newsletter. Just click the link in the episode description. Welcome to Trying to Conceive with Dr. Sasha Hakman. Today is a solo episode, and we're going to be talking all about how to optimize your natural fertility. In today's episode, I'm going to be discussing how to maximize your chance at a pregnancy on a monthly basis by covering things like best ways to track your ovulation and know exactly when your peak fertility is, sexual practices to maximize that chance at a pregnancy every month. And of course, we're going to talk about lifestyle measures in detail, everything from nutrition, exercise to supplements and sleep habits. If you have been trying to conceive for over a year, if you're under 35, or 6 months, if you're over the age of 35, it is not a bad idea to go see a fertility specialist and get a proper evaluation. If seeking care from a fertility specialist is a little bit out of reach, either geographically speaking or financially speaking, it's always a good idea to have in-depth discussions with your OBGYN who could actually do a lot of the preliminary testing for you or send them out. Now, you might be in the very beginning of your TTC journey. You may not have even started yet, but you want to understand more about reproductive health and how to improve it potentially, or know that everything looks good. Or you might be someone who's actually been trying for quite some time and is just not ready to take that leap into an evaluation. So this episode is for you. If you are someone who hasn't even started trying, but you really want to gather information about your reproductive health, whether it be your anatomy, your ovulation, your partner's sperm, then you don't have to wait a year or even 6 months to go and get that evaluation. It's really up to you on when to get these tests done. And if you go and ask your doctor before even starting to try and they tell you no, then it's time to go see somebody else, because you don't have to wait to get the initial testing done just to ensure that everything looks good. That being said, you also don't have to go get any testing prior to trying. So let's start with understanding the fertile window. The fertile window actually includes a 6-day period leading up to and including the day of ovulation. This is because if you're having sex after you've ovulated, the chances of a conception significantly decrease. It doesn't mean that you can't get pregnant after you've ovulated. It just means it's a lot less likely to happen. There have been a lot of studies looking into when is the best time to have sex leading up to ovulation, and it appears that about 2 days before ovulation is really the magic time in terms of the peak likelihood of conception. But anything in the fertile window is a really great time to have frequent intercourse. And we're going to go over coital practices or sexual practices shortly. But let's start by understanding how you know when your fertile window is. So there's a number of ways to detect how and when you're ovulating. If we look at something that has become extremely popular, and I think it is a great method to truly understanding your body, there is the fertility awareness method. And this involves a number of different tools that you can use to understand when you're ovulating. So the first and most common tool that most women I know are using to track their ovulation is through use of apps. They're actually using the calendar method. So how does the calendar method work? Let's just say that I personally have a 30-day menstrual cycle. That means the first day of my period is cycle day 1, and 31 days later is when I'm going to start my next period. So the days in between 2 periods is 30 days. Generally speaking, the luteal phase tends to be consistent around 14 days. Now, this is a little more nuanced because it's not always 14 days for everybody, but that tends to be more stereotypical and pretty common for the luteal phase to be almost exactly 2 weeks. If we're assuming the luteal phase is 2 weeks, that means you take the 30 days, you subtract 14 from the 30, and that indicates you should be ovulating on cycle day 16. And that's because the follicular phase is the more variable phase. So the calendar method is really helpful if your menstrual cycles are extremely predictable and there's very little to no variability. And the reason for that is because if you have variability between menstrual cycles, which is actually quite common and is considered normal as long as that variability is within a week, then you are missing the mark most of the time. And I have patients who make this mistake often, where they think that they're ovulating on a particular day because the app said so, because the app is assuming that there's little to no variability in your menstrual cycles. So it doesn't actually act as a very reliable tool to know when you're ovulating. But what I like the apps and the calendar method for is if you have really regular cycles and you are keeping track of when your menstrual cycle starts and you keep documenting it, you can over time see the pattern of what your cycles are doing. And it helps you to understand your own body and your menstrual cycle a lot more. Looking at physical signs. So for instance, as you get closer to ovulation, you may notice that you're actually having some vaginal discharge that becomes more clear and sort of has the consistency of raw egg whites. If you put it in your fingers, it's kind of sticky and it's clear. That's usually what it looks like. Some women are really good at detecting this close to ovulation, and this mucus is actually increasing as your estrogen levels increase. Estrogen is on the rise up until the point of ovulation, and so you will generally see this increase in cervical mucus. That being said, and especially as a reproductive endocrinologist who does frequent pelvic exams with speculums, inseminations right at the time of ovulation, it is not uncommon that I will actually see a woman who does not have any cervical mucus. And so it doesn't really work for everybody. But if you are somebody who consistently shows this sign, that is a very helpful tool to know when you're going to ovulate. This usually will be used in conjunction with other methods like checking your basal body temperature. There are very specific thermometers down to the decimal point that will help you detect changes in your temperature. And when your basal body temperature rises, this is how you know that you have ovulated. Now, this is a helpful tool to know you actually did ovulate, but will not help you predict when you're going to ovulate. So the problem with basal body temperature is that once you have that change, it's too late if you haven't already had sex. Now, some of you are going to be looking into these different tools and methods and think, why would I need to even do all of this? I'm having sex all the time with my partner. If that's the case, then it's probably a little bit less critical that you know exactly when your ovulation date is happening. But for those who are sort of limiting intercourse, or they have busy careers, they're often traveling out of town and they really need to time things, this is where understanding when your ovulation is happening is incredibly important to time sex. Okay, so the next one is ovulation predictor kits, which is one of my favorite methods and tools. Ovulation predictor kits are basically these little LH strips because as your LH is rising, this is the hormone secreted from the brain to release the egg. As it rises, you tend to pee a lot of it out, and that can be detected on these little monitors that look like pregnancy tests. There are more sophisticated monitors that are also checking metabolites of estrogen, which is called estrone glucuronide. This can also help detail exactly when your peak fertility is and confirm it in conjunction with that LH surge. Now, the LH surge that you detect on an ovulation predictor kit usually indicates that you're going to ovulate somewhere in the next 2 days. There's a lot of variability there, but you know within the next 2 days, you are most likely going to release an egg. The downside to the ovulation predictor kits is that in about 7% of cases, you are going to get a false positive. So you get falsely reassured that you think you're ovulating, but you are not. The other caveat to that is if you have PCOS or polycystic ovary syndrome, you tend to make a lot of LH. And so you might actually be using these ovulation predictor kits that tend to show up positive a lot. And that's because you have an abnormally high level of LH, and it's not because you're actually ovulating. So this is where combining that with other tools can be really helpful. Now, one thing I do like about certain monitors like Inedo, this is where you can actually see other metabolites you are going to continue tracking. And if it shows you that your progesterone is rising, that helps to indicate that you, in fact, did release an egg. It helps to confirm ovulation. If you didn't ovulate, your progesterone levels are not going to rise up until a certain point. So that helps you know for certain if the egg was released. Now, the likelihood of having an actual LH surge, and I'm not talking about a false positive here, I'm talking about a real LH surge, and not releasing an egg is very unlikely. But the reality is if you're having pretty regular menstrual cycles and you're getting a surge, then it's pretty safe to say that you actually release the egg. It's very rare that you're going to have an LH surge and not actually release the egg. So these are all your fertility awareness method tools that you can use at home to track your ovulation. Of course, the best way to track ovulation, the most accurate way, is in a fertility clinic, a combination of tracking with ultrasound to see how many follicles you have growing and what size they're at, in conjunction with lab draws, looking at your estrogen levels to see when it peaks, to see when your LH surge is occurring, and then confirming it with a rise in progesterone. Now, in most cases, this is really not necessary, but if you're someone who is constantly trying to track your ovulation, but you're not actually releasing an egg, or it's all over the place and your menstrual cycles are irregular, this is where it's really important to go into a clinic, either with your OBGYN, who is well-versed in how to do this, as well as a fertility doctor who can track your cycles to figure out what your cycle patterns are. You can still use more natural methods at conceiving. It would just be a way to monitor and detect your ovulation cycles. Okay, so now let's talk about sexual practices. This means positions, timing of intercourse, frequency of intercourse, lubricants, all these things matter. So starting with sexual positions, there is no position that is actually going to increase your likelihood of conception. I see this myth circulating all the time. And you actually don't even need to lay down after sex in order to wait for the sperm to get to the egg or make its way through the uterine cavity into the fallopian tube. All of that is really unnecessary. A lot of studies have actually looked into this and have found that the sperm usually, if it is deposited at the end of the vagina, it will within 2 minutes make its way to the fallopian tube within 15 minutes of sex. So after you're done having sex, you don't have to lay down to try to keep the semen in the vagina, because the ones that will make it there very quickly. Now, of course, if you want to lay down because it makes you feel better about it, you absolutely can, but it is certainly not necessary. There's also no sex positions that are going to increase your likelihood of a pregnancy. It really does not matter. And not to mention different timing of sex according to when you're ovulating, and positions are also not going to manipulate the likelihood of having a particular gender. Now, when it comes to other things that are used during sex, like lubricants, there are a lot of in vitro studies looking at different ingredients within lubricants that have shown to negatively affect the sperm motility, meaning their ability to swim. So we know that water-based lubes, things like KY jelly, are not great for sperm in vitro. More naturopathic lubricants, like using olive oil, can also be detrimental to sperm. So it's not usually recommended to use those types of ingredients. I really like lubricants that have a hydroxyethyl cellulose base, it's actually been shown that using things like canola oil can actually be safe to use when trying to conceive. That being said, studies that are not in vitro looking at couples using lubricants have been found to have just as high of a likelihood of conception as those not using lubricants. But currently on the market, probably the most popular lubricant out there that's safe to use when trying to conceive is pre-seed. Today, I want to talk to you about a tool I personally recommend to my patients who are trying to conceive, Inedo. Inedo is the first at-home fertility monitor that tracks 4 key hormones, estrogen, LH, FSH, and PDG, using a single easy test strip. And in just 10 minutes, it gives you incredibly accurate hormone readings, but without the stress of lab visits. Inedo can help you detect your fertile window with precision, predict ovulation reliably, and then confirm ovulation has occurred, giving you a complete understanding of your cycle. This comprehensive hormone tracking becomes particularly critical when we consider anovulation, which is the leading cause of infertility and often goes undetected. Inedo serves as an indispensable tool here, not just for predicting ovulation, but more crucially for confirming it. It achieves this through a sustained rise in PDG, the urine metabolite of progesterone. As a physician, I trust the data Inedo provides. I use it to monitor how my patients are responding to treatment, and I can adjust their plans in real time based on actual hormone levels. So if you're looking to take control of your fertility with clarity and confidence, I highly recommend Inedo. Head over to Inedo.com and use my code TTCPodcast to get your starter pack for just $89. That's INITO.com. Now, another tool that I see a lot of people using and a lot of companies are trying to heavily market it as improving likelihood of pregnancy is using the cups where you deposit sperm and place it in the vagina. Now, those are really only helpful if you are trying to avoid intercourse for whatever reason. If sex is not happening or cannot happen for some reason, then using a syringe to drop the sperm or using a cup for sperm that goes against the cervix can be helpful. But outside of that context, if you're having sex, using those devices is frankly just a waste of money. Okay, so let's get into lifestyle, starting with nutrition. The tricky thing about studying nutrition is that a lot of it is observational studies. It's really, really hard to control what people eat, and it's hard to gather really good data without having inevitably some confounding factors. So when we look at the best dietary practices to improve fertility, one of the biggest studies that most of us will quote is the Nurses' Health Study out of Harvard. And this included a lot of women. So it's got pretty good data, and they coined the term the fertility diet, which is essentially more plant-based proteins, lots of omega-3 fatty acids, low glycemic index carbohydrates, and polyunsaturated fats. That has been shown to sort of be the ideal diet. Other studies have shown that the Mediterranean diet is superior, but what most of these diets have in common is that the primary focus is minimizing processed foods. It's not to say that all processed foods are bad and you should not ever eat processed food. It's just all about your habits and daily patterns. If you're occasionally eating processed foods, it's probably totally fine. But if this is every meal, every day, you're getting frozen meals that you're throwing into the microwave, most of your food comes in plastic, almost nothing is being made at home, very few raw produce, then that's really not optimal. The general thing you want to focus on is you do not want to eliminate any macronutrients. Your 3 main macronutrients are your carbs, your fats, and your proteins. So any major fad diets that are eliminating fat completely or eliminating carbohydrates is really not ideal for reproduction. So do not eliminate any of these 3 macros. If we're going to break it down by macro, starting with your proteins, what has been consistently shown is that having a diet that is heavier in plant proteins versus animal proteins tends to be better. It does not mean that you need to go vegetarian or certainly not vegan. We know that seafood can be really great, especially because of the omega-3 fatty acids, and they contain such high antioxidants that the benefit actually tends to outweigh the issue of microplastics that we tend to see from fish exposure in bodies of water. Of course they are, but we have consistently shown that the consumption of fish is really great. Now, of course, I am somebody who likes to prioritize wild caught, and I really try to outsource my fish from places that I know where the fish have been exposed to little pesticides. Eating fish can actually be really beneficial and is still part of that Mediterranean style diet. Poultry seems to be okay in small quantities. Red meat has actually been shown across the board to negatively impact your reproduction. So I typically recommend to my patients to cut back on red meat. Now, that's not to say I don't have patients who are very successful despite consuming red meat. They're probably a lot more selective of where they get their red meat from, and that's really important to keep in mind. But also, quantity matters. So it really just depends on how much you're consuming. It should not be part of every meal every day, that's for sure. Moving on to fats. Okay, so I guess you can put dairy in the protein section, but also in the fat category. There are some studies showing that low-fat dairy is better and others showing that full-fat dairy is better. The truth is probably somewhere in between. Ultimately, I just tell my patients, whatever your personal preference is, just stick to it. I'm not too concerned about what kind of dairy you're getting. So if you prefer low fat, go for it. If you prefer full fat, enjoy it. Now, in terms of other healthy fats, you really want to avoid saturated fats, okay? So you want your polyunsaturated fats and, once again, omega-3s. Omega-3s can come from fatty fish like salmon, nuts, seeds, avocado, olive oil. But once again, where you source it from does matter. Ultimately, trying to focus on organic or with olive oils, actually seeing on the bottle when the olives were harvested. Are these olives also organic, or were they sprayed with pesticides? These are information that you can actually start to understand over time when selecting which ingredients to get for food. Now, in terms of vegetables and fruits, produce, okay, this is where I always stress to my patients, really try, if you can find it, if it's available to you, to go for produce that has not been sprayed with pesticides, because we know that these are massive endocrine disrupting chemicals that negatively impact reproductive health, your entire endocrine system, and overall health as a whole. In my case, I'm really fortunate to live in Southern California. In LA, we have a weekly farmers market year round where local farms are growing their produce and they are not spraying them with pesticides. Now, if you don't have access to produce like that year round, depending on where you live, then this is where really thoroughly washing your produce and even having it soak in water for 10 minutes with baking soda can really make a big difference. So there's a lot of information when it comes to nutrition, and you'll see things like cutting out dairy, cutting out gluten, and those are really unfounded. There is no real evidence to suggest that you need to do that unless you're lactose intolerant or you have celiac disease or gluten sensitivity. You don't need to eliminate these things. If you're confused about what works best for you in your particular case, because every individual is different, this is where I really stress working with a dietitian. If you work with a dietitian, not only will you learn about nutritional things that are really important for your health, but they will help, based on your own personal medical history, optimize your diet. Moving on to exercise. one of my favorite topics ever. If you know me or you have followed me on social media for a long time, you know that I am obsessed with resistance training and weightlifting. I have gone through so many different phases of my life of what forms of exercise I prefer. And just to give a little bit of my background, in terms of my fitness, growing up, I played a lot of sports. When I was in college, I played on the varsity water polo team. Prior to that, I was a competitive swimmer. I was also a runner, and I ran a few marathons. So I've always sort of delved into the cardio-heavy sports. But eventually, once I was a resident, so after medical school, as an OB/GYN resident, I really started to get heavy into weightlifting, starting with powerlifting. I had a coach. He was amazing. He taught me everything that I really know today, and I've really built on that knowledge over time. And after powerlifting, sort of delved into the bodybuilding world, and I absolutely love resistance training for a number of reasons. Number one, it's data. So if you lift weights and you are doing something called progressive overload, you are seeing the progress from week to week as you're getting stronger because you're lifting heavier. The goal of progressive overload is either to increase the load, so the amount of weights that you're lifting, to increase the sets or the reps from week to week. You're ultimately usually having, let's just say you're working out 3 days a week because you have a busy schedule, and those 3 days are 1 hour exercises of blocks of the same workouts, let's say Monday, Wednesday, Friday. And every Monday, you're going to go up on your weights. Every Wednesday, you're going to go up on your weights for whatever those exercises are. And week to week, you are seeing the progress in your strength. And what we know that what that does is it creates a need for your muscles to have to accommodate this increase in weight. And so now hypertrophy occurs. You are gaining muscle mass. For the ladies, this does not equate to looking bulky, being bulky, or overly muscular. What you're doing is you're increasing your lean mass. And what that does is your muscles sort of act like a sponge for sort of storing your carbohydrates and your sugar. So what that translates into is you have improved insulin sensitivity and decreased insulin resistance. This is particularly important for women who have ovulatory issues related to their weight, or if they have PCOS, regardless of what your weight looks like. If you have lean PCOS, you're still going to highly, highly benefit from resistance training. Now, exercise should be, the minimum recommendation is 150 minutes per week. And you can sort of divide that however which way you want based on what your lifestyle looks like. I tell my patients, if you work out twice a week and those 2 sessions equate to 150 minutes, you don't have to work out every day. But if it's easier for you to do 20 minutes a day, that's also great. You just want to get that movement in. It should be a combination of cardio and resistance training. So it doesn't all have to be resistance training. Cardio is really important for your heart health too. And the combination of the two really can help to optimize your fertility through metabolic parameters and hormonal regulation. That being said, for some, there is such thing as too much exercise. And this is particularly important for women with a history of eating disorders or the female athlete triad / hypothalamic amenorrhea. And it's also really important for women who have a really low BMI. So let's say you have a BMI of 19 and you do 1 hour of vigorous exercise every single day. Now, that might put you over the edge and make your brain think, okay, we're in major stress here. It is not time to have a baby. We cannot get pregnant. And so usually that will translate into some sort of ovulatory dysfunction, or your periods are irregular, you're not ovulating. If you have really low BMI and you are exercising every day, even though it is sort of considered in the range of normal, you might just be very susceptible to this level of exercise and you'd have to cut down. So it's really rare that I tell patients to stop exercising or to really significantly reduce it. Now, if you have a higher BMI and you are doing 1 hour of intense exercise a day, that may not affect you at all. In fact, it might improve your fertility. So it's really a case-by-case basis, and it just depends on your overall current health status and weight. So if there's any doubts with that, always a good idea to talk to a professional about it. So if you feel like your doctor may not really know much about it, then always a good idea to try to find a physician who is well-versed with this. Sometimes it could be something as simple as a sports medicine doctor who has interest in women's health and ovulatory patterns. They can really help you figure out where's your sweet spot in terms of your exercise routine. Now, moving on from exercise, other lifestyle parameters that are really important are environmental toxins. Some of them are really, really obvious, like cigarette smoke. Smokers are way more likely to have a decreased chance of conceiving in a given month. Smoking can affect your fertility through different mechanisms, whether it's the egg or the sperm, but it certainly can affect both. Women tend to be a little more sensitive to cigarette smoking than men. It's probably because we just don't make new eggs. We're born with all the eggs we're ever going to have. And so for female smokers, even if they quit, which is always recommended and is always beneficial to quit, those eggs have already been exposed to the cigarette smoke. So there's a decrease in quantity and quality of the eggs regardless of age. We know that cigarette smoking can also affect the function of the fallopian tubes, which is so important because that's where fertilization takes place. So if you are a smoker or even vaping, I highly recommend you completely stop it and cut it out. Marijuana is another one. Highly, highly utilized both among men and women, even those trying to conceive. A lot of guys think that, okay, well, weed doesn't really affect my sperm, my semen analysis, I did it looks pretty good. Well, we can't see everything that the sperm is doing. And there could be oxidative damage to the sperm, reducing its quality and the DNA within the sperm. So always highly recommended to completely stop consuming cannabis in any form if you are trying to conceive. For the guys, you can quit it 3 to 6 months before starting to try. Lucky for you, you're going to have a whole new batch of sperm. And then for the women, unfortunately, once again, we are born with all of the eggs we're ever going to have. And so the sooner you can stop, the better, just for the sake of improving egg quality. In terms of alcohol consumption, this is a little bit of a tricky one because most people who are trying to conceive are typically not binge drinking or heavily consuming alcohol. So the question is, how much can I drink and still not negatively impact my fertility? The data is a little controversial. There are some studies actually showing that you can have up to 2 drinks a week and it's totally fine for your fertility. But the other thing to consider is that sometimes even when you're trying to track things, you may not be aware of when you're pregnant, and there's technically no safe amount of alcohol in pregnancy. We know that it causes fetal alcohol syndrome. It's teratogenic, meaning it can cause birth defects, and therefore, technically, there's no safe level of alcohol, and it shouldn't be consumed if you're trying to conceive. If you are someone who really just enjoys a glass of wine, socially speaking, it's probably fine to do that in the follicular phase before you ovulate. But after you've ovulated, I always say just don't do it. You can probably hold off on alcohol or stick to non-alcoholic beverages that make it feel more social and enjoyable when you're out to dinner with friends or family. Okay, now supplements. This is sort of a monster topic because I think that there are so many supplements out there, so many that are marketed particularly to the vulnerable population, those dealing with infertility or those who are looking to conceive and really hoping that this is going to happen naturally for them without any assistance from a doctor or clinic. Here are the supplements that are my must-haves. Okay, any woman of reproductive age, whether you're trying to get pregnant or not, you should be on folic acid no matter what. At least 400 micrograms of folic acid every single day. And that's because this is incredibly important for something called the closure of the neural tube. The neural tube is a tube during embryologic development, happens super early, that will lead to the spine and brain. And if there isn't enough folic acid, you can have defects in the closure of this neural tube, which can lead to spine and brain problems. So having folic acid in your system ahead of time is incredibly, incredibly important. Now, there's a lot of debate regarding whether it should be methylated folate because of an MTHFR mutation versus folic acid. Here's what the data shows. 40% of the population has an MTHFR mutation. It doesn't mean anything. mutations or variants that are actually pathologic, that can actually affect your fertility, would be present in less than 1% of the population. In the world of genetics, we call them variants. But the MTHFR variants don't matter. Folic acid has been widely studied and has been shown to be very important for the reduction in neural tube defect cases. Now, lucky for us, a lot of our food is laced with folic acid, which is fantastic. It was a huge public health initiative to reduce the risk of neural tube defects. Designer or fancy prenatal vitamins, some of which I actually love too, are only containing methylated folate, not folic acid. I tell my patients that honestly, it's probably fine, but you don't have to go out seeking prenatals that only contain methylated folate and not folic acid, or go to your doctor to say, hey, I want to get tested for MTHFR. The only clinical setting where MTHFR variants may matter, is if you have 2 copies of the mutation and something called your homocysteine levels, your blood levels of homocysteine are elevated. That could predispose you to blood clots. So still has nothing to do with folic acid, actually. It has to do with the possibility of needing blood thinners for an ongoing pregnancy if you've been dealing with recurrent pregnancy losses, which is a whole different monster topic. I can't stress it enough. If you have a prenatal with methylated folate, that's probably fine too. I actually do prefer 800 micrograms of folic acid though, and this is because there have been a lot of studies showing that the ongoing pregnancy and live birth rate is actually higher if you have higher folic acid intake. But between the 400 and probably what you're getting in your diet, it's likely enough. Now, the second supplement outside of a prenatal is CoQ10. I'm a big fan of CoQ10 for improving egg quality and sperm quality. CoQ10 is a powerful antioxidant. There have been other very great powerful antioxidants have been somewhat studied in our field. There isn't really great, robust data to prove how much it improves egg quality, but my suspicion is that it definitely can't hurt and it probably will help. These are things like NAC or NAD+, although with NAD+, just oral NAD, it does not work. It gets digested in the gut, and so you get essentially no absorption. Either it's a subcutaneous or IV infusion, which can be really expensive, or if you're going to take it in the tablet form, it's got to be the precursor NMN. Although there's some emerging data to show that if it's a liposomal supplement for NAD, then that could also be well absorbed also. And acetylcysteine or NAC. So there is more and more out there about these powerful antioxidants, glutathione being another one. That being said, I just usually say don't break the bank trying to get all of these different supplements. And certainly if you can't do the basics, which is good nutrition, exercise routine, and then we're also going to get into adequate sleep, reducing environmental toxins, all of these supplements are not going to do much for you. You got to have the basics first when it comes to your lifestyle before spending all this money for expensive supplements. So that brings me to sleep. Sleep is so critical to your reproduction because while you're sleeping, this is where a lot of the hormone signaling happens. Hormones are messengers, and most of these hormone messengers are coming from the brain, and they're talking to our reproductive organs to tell them what to do. A lot of this signaling is happening overnight. So if you're not getting adequate sleep or good quality sleep, that can throw off these hormonal patterns. It can lead to ovulatory dysfunction. It can also just decrease the likelihood of fertilization and embryo development taking place because of all the hormone signaling that is important in this process. If you are incredibly stressed and you have poor sleep, that elevated cortisol, that can also negatively impact both your natural fertility and the success of fertility treatments for those who are going through fertility treatments. The general recommendation is pretty easy. You want to aim to get 7 to 9 hours of sleep per night as much as you can. I always say my rule of thumb is to be in bed before 11 p.m. And you want lower temperature in the room. So actually below 70 degrees, believe it or not. And if you're somebody who gets cold, I get it, but it really does improve the quality of your sleep. And of course, there's, probably most people know this by now, but you want to avoid caffeine in the evenings. You don't want to drink too much fluids before going to bed to avoid having to wake up to pee. Reducing screen time immediately before bed by an hour or two will help improve the quality of your sleep. And finally, stress reduction. This is so important, so underrated. Infertility is obviously not a mindset. It is a medical diagnosis, but we cannot underplay the effects of stress on your fertility. My bigger concern is the ongoing chronic low-grade stress. It's sort of telling your body that there's always something wrong. You're constantly in fight or flight. You're high anxiety, and you never get a moment to sort of reduce that stress. Everybody's susceptibility to stress on how it impacts their reproduction is variable, but obviously it can affect you. And if it does, this is where trying to find different techniques to reduce that stress. I mean, in a perfect world, you're going to reduce the source of stress, but in many cases, it's our jobs, right? And what a luxury it would be to just say, work is too stressful, I'm not going in. That's just not reality. So you have to find tools to help overcome this chronic stress that you're dealing with. Whether it's mindfulness, meditation is honestly one of my favorites. I think that it's highly underutilized because even though everybody knows about it, because it's almost like another thing you have to worry about, another thing you have to do. So I'm already stressed. Now you want to add to my plate with something else I have to do. But I think that once you get into the habit or you find a really great app that can help sort of center you in a moment where you feel incredibly anxious and stressed out, you will find a difference just in your whole system. You'll just feel a lot less stressed. And that's something important to implement into your routine if stress is a big problem in your life. And I finally want to end it with environmental toxins because this has been a growing topic and it is something that we know is significantly impacting our fertility. Environmental toxins are everywhere. We literally cannot avoid them, unfortunately. So it's not about avoiding environmental toxins, it's about reducing exposure. So what are these environmental toxins? We're talking about phthalates, parabens, BPAs, any endocrine disrupting chemical that's present in our air, our water, our food, almost all of our household products, whether it's cleaning products, laundry detergent, our skincare, makeup, certainly fragrances is a really, really bad one. They're sort of everywhere. So where do you even start? So just starting to learn and understand where they're present is a great place because then you can start to figure out where to eliminate these endocrine disrupting chemicals. And what are endocrine disrupting chemicals or EDCs? EDCs are basically something that mimics a hormone. So it binds to the hormone receptor and it either blocks the action that it needs to do or it elicits a totally different action. And so it can interfere with the normal messaging process that's important for your entire endocrine system and certainly your reproductive system. So easy places to start eliminating would be avoiding plastic bottles or any plastic containers. Do not heat food in anything plastic, or don't place hot food on anything plastic. It essentially sort of melts layers of plastic into your food. And these are chemicals that are generally known as forever chemicals and can really interfere with normal hormone signaling. Other small places that you might encounter this is in the kitchen when you are cutting things. If you are using a plastic cutting board, you're literally cutting microplastics into your food. And it is now present in the follicular fluid of female ovaries. So the follicle that contains an egg, surrounded by the fluid that's important for nourishing the egg, has microplastics. It's awful. We don't know the implications of that long term. We are seeing a trend in decreased fertility over the years. And so we know that the environment has been playing a role. In terms of air, But when you're inside the house, you can have air filters and purify the air that you're breathing, at least when you're at home. And that's probably a significant portion of your days, and certainly overnight too. So that's a good place to reduce exposure. Like I previously said, when I was talking about diet and nutrition, when it comes to your produce, really thoroughly washing it with baking soda to help sort of rinse off the pesticides is a great tool to reduce exposure to EDCs. And then for the ladies, when it comes to your skincare, all of your personal products that you're using in the shower, hair care products, all of it, you want to stick to non-toxic brands. And so there's a lot of brands that have been having these initiatives to avoid having any EDCs in their products. And don't be fooled by that green check mark that you see at Sephora. You want to read the ingredients label. If anything has synthetic fragrances on it, that's a big no for me. Same with your laundry detergent. You're washing your clothes in it, and then you're wearing your clothes and you're sweating in it. Don't use laundry detergent with fragrances. If it smells strong or it smells nice, it's probably not good for you. So that concludes all of the things that you can do to optimize your natural fertility. Once again, if you think that there may be something wrong with your cycles, if there's any concern about sperm because of libido or erectile dysfunction, if there's concern for endometriosis affecting fertility, these are all reasons to go in and see a fertility specialist right away, at least get the initial evaluation to see how things are looking.